Okay, good afternoon, and thank you all for attending the Joint Conference Committee meeting of Laguna Honda Hospital and Rehab Center for April 14th. Mr. Morwitz, can you call the roll?
Yes, I'll start with you, Vice President Guillermo,
Present?
President Green,
Present.
and Commissioner Chow.
Present.
Thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, the March 10th, 2025 Laguna Honda JCC minutes.
You have the minutes before you. Is there a motion to approve?
So moved.
Second.
Okay, all those in favor?
Oh, actually, we need
Oh,
some
sorry.
public comment. That's okay. Any public comment in the room? Is this on the minutes?
On the minutes.
On the minutes. Okay. Okay, great. I see 2 hands. Hi, caller, please let us know that you're there.
I am eccentric.
All right, Mr. Minetshaw, you've got 3 minutes.
Okay, thank you, Mark. Wait a second. Here we go. Oh,
We're on the minutes. Do you realize we're on the minutes?
yes.
Okay.
For the March 10th, 2025 LHH JCC meeting minutes, they are deficient because they do not report that Dilter Sidhu, LHH's CEO, stated on slide number 4 that regarding LHH's 120-bed waiver request to CMS, quote, "We are working on a resubmission response," end quote. Why wasn't Sidhu's statement included in the meeting minutes? As well, on April 7th, directors I informed the full Health Commission that SFDPH/LHH would be submitting, quote, "another letter to CMS this week," end quote, about the 120-bed waiver. I placed a records request on April 2nd to SFDPH's public records staff, requesting LHH's, quote, "resubmitted waiver request submitted to CMS," end quote. I received a response to my records request today that stated, quote, "we have no responsive records," end quote. That indicates LHH has not resubmitted a follow-up appeal yet to CMS. What is taking so long to provide LHH's written resubmission to CMS about saving the 120 beds? After all, LHH operated the 3-room suite of bedrooms for a dozen years, between 2010 when the new hospital opened and April 14th, 2022. If LHH could operate those 3-bedroom suites for a dozen years, it should not be punished due to a CMS rule change in 2016. When is this waiver request going to be resubmitted, and why is it taking so long to resubmit? Why isn't there a sense of urgency about resubmitting a written waiver request? Thank you.
All right, thank you. One more. Well, actually, that's the only hand for this item.
Okay, thank you. So we can take a vote. All those in favor?
Aye.
Any opposed?
Okay, great. We can move on to general public comment. Would you like to make general public comment? Yes, please stand up, and you've got 3 minutes. A buzzer will go off that will give you a 30-second warning, and then after that, the buzzer means that your time is up.
Okay. My name is Norman Dagelman, and I'm a member of the Gray Panthers, and I'm quoting Dr. Teresa Palmer today. First of all, Mr. Morwitz, please share with Health Commission Director Tsai, Dr. Lamb, and Laguna Honda leaders. Here's testimony in reference to April 14th LHH JCC agenda. Please include in the minutes. I'm talking about agenda number 4 now. When was the second waiver application submitted for 120 beds? We need an
yeah,
update at every health.
Mr. Dagelman?
Yeah.
I'm sorry to interrupt you, but so this is general public comment, which is for items that are not on the agenda. So it sounds like you're talking about item 4.
And 5. Yeah, that's
All
what
right.
I'm
So you
interested
need-
in.
So this is not the right time to talk
Okay.
about that.
Thank you.
Okay, sure. There is anyone else in the room? All right, there's a remote public comment. Mr. Minetshaw, do you have a comment for general public comment?
No, I thought you muted me. I should have muted myself. Sorry.
Okay. All right. So it sounds like there's no other public comment for this item. We can move on to item 4, the executive team report.
Okay, good afternoon, everybody. Dilter will come up shortly to do the executive team report. This is Dan Tsai, the director of DPH, for those on dialed in. I just wanted to note something I had said at when was the commission meeting? This past Monday.
The 7th.
Time flies. It feels like a long time ago. One of my priorities and the team's priorities is to do everything possible to secure a CMS waiver of the 120 beds that's been often referenced. And I just want to note for this committee here, this commission meeting, some of the things I had noted there and provide an additional update as well. So I think I just want to reaffirm we share the sense of urgency for getting the 120 bed waiver authority. We need more skilled nursing beds in San Francisco. That is very, very clear in my first 5.5, 6 weeks, as we look at some of the challenges we have in the city and county overall. And so we absolutely need that. And we need that also at a facility like Laguna Honda. And so I think we provided updates in the past around some of the work that the team has been doing, past discussions with CMS. And I do want to note, we have submitted, after some additional discussion with CMS formally on Friday, an updated request for a CMS waiver. And I just want to highlight a few things that we said in that letter. And part of why we sent it on Friday was, for me, having come from CMS, I know we are often most effective if the team is able to have subject matter experts have calls with CMS to understand where their head is on things. And so we can craft a very pointed response to be as effective as possible. So there are a few things that we said in that letter, and Diltar might go through a range of these things in the report shortly, but this is important enough that I wanted to just reemphasize this. Number one, we said in the letter very clearly that from a legal standpoint, we think the federal government needs to grant us this waiver of 120 beds, and we outline a legal reason why. We already know that CMS disagrees with that perspective, but for everybody, I want you all to know that we do feel it's important to start with that, to pound the table on that, and to know that we think we have a legal argument there. And then we say, well, even if you disagree with us on that, which we don't concede, we go through a range of reasons why we think the structure of the 3 bedrooms in Laguna Honda, which is really the source, as folks know, of the 120 bed waiver, why they are really unique and why they're actually beneficial to our community as a whole. And we also include pictures of the rooms, square footage, things of that sort that make very clear that this is not, when people often think of a 3-bed congregate room, a small crowded room, et cetera, the square footage we have far exceeds what CMS expects of skilled nursing facility spaces generally. And in most of those rooms, we have actually walls dividing where the beds are, with a shared bathroom and some common space. So based on discussions with CMS, we outlined all of those things as compellingly as we could. It is a very long letter. It has many exhibits in it. Those things are there for a reason, based on discussions we've had with CMS. I would note CMS has been clear that their policy precedent is, in our situation, is to not, grant a waiver of this sort. But I want to be clear, our team is pounding the table. And so we officially submitted that to CMS on Friday based on our understanding of some of the contours of what CMS has been thinking about. So that's a very, very important update. I know that's been important to the community, and we've asked for as quick of a response as possible. And so that, I thought I would just start with that update given the amount of discussion on this. And I think with that, I'll pass it to Diltar for the broader executive report. Thank you.
Appreciate that update. And well, I mean, it does indicate the urgency and I think the assertiveness, that stance that we are taking at this point. So hopefully we'll hear better news, even though we know that the likelihood or the percentage of the likelihood is probably below.
But we will, fall on this hill trying for lack of, we're going to do everything we can. And I should have added one other thing. We also spent time with CMS on the regulations. They have clarified that CMS is the sole arbiter of this decision. It is not delegated to the state of California, for example, but where CMS rules on this waiver request is the final agency action in their view and kind of the I don't know, the last stop on the bus, if you will. But that was part of our discussion with them as well.
Thank you. Diltar.
Good evening, Commissioners. My name is Deltar Sidhu. I'm the Nursing Home Administrator and CEO for Laguna Honda Hospital, here to present our monthly exec report. You all have the report in front of you, so I'll go through some key points. First, I want to thank our Director, Dan, for kind of outlining, as that was my first update regarding the waiver, which was submitted Friday. And he's outlined, so I'm not going to repeat what he said. The reason it took some time, I'll just highlight that we wanted to make sure that the letter is robust. And we have the feedback from, obviously, Director Dan, and the feedback from our subject matter experts to ensure that the letter is robust so we can make a case that these bids are vital, not only to the residents of Laguna Honda, but also to the community of our community. But happy to share, and if you have any questions, I'll be happy to answer those. Also, if you go to slide 3, wanted to highlight a little bit our staff. As you know, we did an employee engagement survey back in 2023. It was identified that the staff wellness was a top priority, so we've been working on it since then. We are providing staff with more engagement activities, including we have revamped the wellness hub for employees and having some pop-up events to really kind of bring awareness so the employees can feel a sense of belonging in Laguna Honda and really focus on their health and well-being as well. As you know, skilled nursing facility is a very challenging environment, so we want to make sure employees feel welcomed and valued in our organization. On slide 4, also wanted to highlight regarding our sustainability and stabilization plan. I wanted to share that we just completed our 3rd mock survey with HSAG, which is part of our organizational assessment and a survey process which is conducted by HSAG as part of the quality improvement expert process that we have. This is the series of many surveys that we will continue to have in years to come. We are pending the receipt of the formal results, but I do want to share that it does continue to show, based on the exit, that we are on a path to continue to improve based on the findings that were shared in the exit. You will have the full report once we have the survey findings from HSAG. And we will respond with our plans of correction as part of the process, and those will be shared with JCC. On our admissions, on slide 8, I wanted to share that we continue to do well on the pace of admissions. In the month of March, we admitted 46 new residents. That was the highest number since our admissions have resumed back in July of 2024. This is going to allow us to continue meeting our target of 7 to 10 admissions per week and bring us to full census before the end of the year. Also, as part of the admissions process, wanted to highlight on slide 6 that our teams have been working hard to improve the process of admission. We have revamped not only our network priority 3 application, but also a community application, which was very lengthy in the past. We have made it more streamlined to make it easier for the community to apply to Laguna Honda. The website's also been revamped, which now includes a virtual tour of the facility. So many residents, families who may not be able to visit the facility do have the option to go online and look at the tour, virtual tour of the facility to really outline a wonderful Laguna Honda that offers many services which exceeds many skilled nursing facility in the community. That would conclude my presentation. If you have any questions, I would be more than happy to answer those. Thank you.
Thank you, Diltar. Is there any public comment?
I believe there's public comment in the room. Mr. Degelman, this is your opportunity to speak about item 4, but only comments on item 4. Item 5, please wait till item 5. Okay.
Okay, let me start again. My name is Norman Degelman, and I'm a member of the Gray Panthers, and I'm quoting Dr. Teresa Palmer today. First of all, Mr. Moritz, please share with Health Commission Director Tsai, Dr. Lam, and Laguna Honda leaders. Here is the testimony in reference to April 14th LHH JCC agenda. Please include in the minutes. When agenda item 4, executive, okay, now we're on agenda item 4, executive report. When was the second waiver application submitted for the 120 beds? We need an update at every Health Commission meeting. In referenced website, correct website is sfgov/new Laguna Honda. There is no description of the fact that someone who needs long-term care for help with LDLS but not rehab is eligible for admission. Website states that folks with commercial insurance or Medicare Advantage are not available to apply. Not true. An emergency disenrollment from Medicare Advantage to traditional Medicare can occur quickly, as can a request to insurance for an exception. In any case, the medical insurance may cover post-acute rehab, but does not cover long-term care. Only Medi-Cal, long-term care insurance, and cash does. LHH should not discriminate against long-term care residents. Residents that qualify for Medi-Cal, even without Medicare, financially should be encouraged to apply. Above all, our public nursing home should not discourage Medi-Cal eligible San Franciscans. And Mr. Morowitz, I was wondering, can I comment on agenda item 5?
No, not at this time.
Okay, thank you.
Okay, thank you. And we've got 2 remote commenters. Dr. Palmer?
Yeah, can you hear me?
Yes, please begin.
Okay. Mr. Degelman read the Gray Panther stance, and one of the reasons we're concerned with that is one of the hardest things to do when you're taking care of someone who is medically complex at home, or you're advocating for them in a residential care facility where their needs are not being met, is to apply for a nursing home while your day is overfull, meeting their many needs. And the website that you quoted in the executive report doesn't specifically say that someone who's not getting rehab, who's at home and eligible for Medi-Cal can get in. And one of the things about someone who's chronically ill at home is they may qualify for a few weeks of Medicare-related rehab, but they're going to end up living at the nursing home with their bills being paid on Medi-Cal. And so the public needs to understand this, and people that are running into trouble at home or in residential care facilities need all the help they can get. They don't necessarily have a social worker who's going to help them. I went through this myself with my mother, and I think it's still in 2017, and I think it's still true now, that the paperwork is very confusing. I'm very, very grateful to Dr. Tsai and the whole Laguna Honda team for streamlining this and having more explanatory material, but I think we have to make a point of communicating in layman's language to the most vulnerable, which is people that are being taken, either trying to take care of themselves or being taken care of by elderly relatives and overwhelmed family at home or in an understaffed residential care facility. And those people need all the help they can get to apply to Laguna Honda. So I'd like the writing to be a lot clearer in the part of the website that explains eligibility. But thanks for all your work, and thanks for clarifying when the waiver was submitted and for your commitment in pursuing this waiver. If worse comes to worse, I'm wondering if walls can be extended and a bathroom added, and how much that would cost to save those 120 beds. Thank you very much.
All right, thank you. And we've got one more comment. Mr. Minetshaw, you're up.
All right, thank you, Mark.
Slide number 13, admissions update, is a textbook case of moving the goalposts between July 31st, 2024 and March 31st, 25 July, using statistics. This is President Trump-like moving goalposts. LHH newly adds not yet admitted patients to the previously titled admitted column to artificially inflate the number and pace of admissions. Not yet admitted should be counted in the pending, in progress column. The state of the hospital slide reports the hospital census at 457 in March 2025 and 474 residents in April, for a net increase of 17 residents. It reports an increase of 10 additional admissions, 36 to 46 admits. But the 46 admits in March were offset by 8 fewer residents, deaths, planned discharges, AMAs/AWOLs, a net change of 36 residents. Why didn't the total hospital census increase by 36 rather than just 17? Is that because of unethically lumping not yet admitted patients into the admissions category goalpost switcheroo? Director Tsai, please circle back and stress to CMS that LHH operated the 3-bedroom suites after the 2016 rule change for another 6 years, and if LHH had not, repeat not, been decertified, it would still have CMS approval dating back to 2010 to continue operating those 120 beds. This is just about the date of CMS artificial rule change. As well, the state of the hospital report shows a total census of 407 for July 2024, when admissions resumed, and a census of 474 8 months later, in March 2025, an addition of 67 patients to the total census, which averages just 8.4 more residents each month, not LHH's target of 7 to 10 admissions per week. LHH will not get to full census by December 31st, 2025, given deaths and discharges, and an average of just 8.4 residents added to the census each month. The key points one-page summary, reported HSAG will share the third organizational assessment documents and plan of correction with this JCC. You should make those documents publicly available to members of the public, too. The 120-bed waiver must be submitted to CDPH, even if the 120 beds will be restricted to Medi-Cal-only patients, because LHH patient payer mix averages 96% Medi-Cal patients annually. LHH can't abandon those 120 beds. Thank you. Item number...
All right, that is the last public comment for this item.
Okay, thank you. Are there any questions or comments from members of the committee on the executive report? Dr. Chow.
Yes, thank you. And thank you for your report and the data in regards to the improvement in terms of management of the applications and the upward trend of admissions. I mean, we're obviously going to continue to always deal with the question of the discharges and also the deaths. But I think our key data point here is to see that the admissions are increasing. So within that, there was the public testimony statement from the Gray Panthers, which I was trying to confirm that we in fact have on the website that we're not accepting commercial or Medicare Advantage patients. And I'm wondering what is the policy in regards to this? And number two, does that also apply to rehab, which is somewhat of a different situation? I couldn't find on the website where Dr. Palmer was speaking to, and so I couldn't verify what you exactly are saying there. So I've chosen to ask you.
Thank you, Commissioner Chow, for your question. So we don't say that we don't accept those. So we're not contracted with those insurance, commercial insurances, and we're not able to advise them legally that they have to drop from those insurance. What we do advise them is these are the ones so we do engage with them. If somebody does apply and they don't have the right type of insurance, we do engage and let them know which insurances are accepted. And then if they make a choice to drop their commercial insurance and enroll in something that we do accept, and we do work with them and admit them.
Okay, so I think that's assuming that we have not also worked with the carriers in regards to being part of their network on commercial insurance. But depending upon, and so your policy is extending to the rehab unit also?
It's the same, and we just
It's the same policy.
it's the same policy, but I do wanted to add, in case-by-case basis, we do work with these commercial insurance. If they were to give us a memorandum, MOU, a memorandum of understanding, and they would like to pay us for us to be able to house those residents. For example, we had residents at St. Anne's that had Kaiser as an insurance, and we worked with Kaiser to get an MOU so they could cover their room and board. Because typically these insurance companies would like to have their member go to facilities they're contracted with. So we don't automatically deny those residents, but there's ways to work around where we support them through the transition.
Okay, so I think I'm looking at two different questions in this in the population. One is the work that we do in rehab, which should be acute rehab, basically. We have an excellent facility, and I think we've been talking about this for years, that we need to be more proactive in reaching out to see if our, and where the impediments are for us to be able to become contracted providers of the large commercial companies so that we are in network. But even if we're not in network, not knowing what it says on the website, but if in fact it might be more proactive to say, if you really have, noted and it looks like you have, I don't know, there are videos or discussion behind your points of services, because I didn't have the time to do that. But if we then encourage first of all, we can become a contractor provider. That would be great, of course. If not, we could encourage our potential patients to actually work with them to obtain the MOU or the exemption from the in-network, because plans do that all the time. Sometimes it's the fact that we have better services than someone else. That we could show that we can do rehab better than XYZ. And that makes a difference to them, because then in that case, we could even say our length of stay is shorter. And so that there are a number of reasons that they might then first become a contractor, or if not, at least for the type of case that perhaps the patient wants to come to Laguna, that they would be persuaded to have a MOU with you. So like you have done with Kaiser, I think that there's an opportunity to really build rehab. In terms of SNF has both the short term, as we know, which is a Medicare product, and then long term. So it sounds to me, and so this might be a misinterpretation by the public in terms of looking at the website, that it seemed to say, or at least the comments seem to say, that we don't accept Medi-Cal only. So perhaps we should clarify, if somebody was in need of long-term care meeting the skilled nursing requirements on long-term care under Medi-Cal, are we denying those, or we actually should be encouraging them, because that's sort of the population we're looking at taking care of?
Just want to clarify that I understand your question. So you're saying if somebody is on Medi-Cal and they need rehab, are we denying them?
No, I'm saying, well, we need to define rehab. So I'm saying that if somebody with Medi-Cal required the services legitimately that we offer at Laguna for long-term care, are we in this public-facing website seemingly denying that?
No, not at all. I mean, we're a safety net hospital, right? That's our primary population, people who need these services the most. We don't deny somebody whether they have insurance or not. We work with them to ensure that they can get these services, especially the ones who needs the most.
Okay, so there's an outreach. So if we then took, because we're looking at, increasing our population here, and reaching out to our residents, if we took this circumstance that there may be someone in residential care at the moment who really actually needs a better support system, how is it that they would then be able to apply to you for this? I mean, what do we show in our websites that this is available from just the patient standpoint and the family standpoint? They don't have a social worker.
We have a very clear criteria for admission to Laguna Honda, which is on the website. And we continue to do community outreach. Dr. Lam can speak more to it. We have engaged with different community partners to really educate them all the services that we have available, so we can continue to engage the community and bring awareness, because we have a lot of vacant beds and we want to be able to provide these services to those residents who need them. And also I want to bring your attention to one of the slides has this data on the exec report. We have very few. Insurance is not the reason for the denial. Our top 3 reasons are something other than their health insurance. So that's not something that we have often denied patients admission to Laguna Honda, because they didn't have the right insurance.
Okay, so perhaps then it would be very nice if on the website we were told how to look for the criteria for admission, because I actually didn't find it. I will admit I didn't spend more than about 5 minutes on it. But if you could provide that, then I think we could all understand how this criteria is written. And because everything you're saying, I think, is what we like to hear, that we are happy about that. But maybe we're not as clear to the public that there is a way to, be able to bring their loved ones and have that as an option to them.
I'll be happy to look at the website and provide that information. to make sure it's covered.
No, I appreciate your clarification and really would look forward to being able to search the website more intelligently. Thank you.
Thank you.
Thank you. Yes, President Green.
Yes, well, I would echo what Commissioner Chow said. I mean, remember that in testimony, our current HHS secretary did not know the difference between Medi-Cal and Medicare. So I think if you're starting from that basis, it would be really difficult. I did look at the website just very briefly, and I think most people may not really realize that San Francisco Health Plan is a managed Medi-Cal, not Medicare. The other thing is that, you think you can go from MA to straight Medicare, but if you're going to do it with a supplement, there are pre-existing conditions, and it isn't so easy to get a supplement. So I think there are many, many barriers and difficulties for people who don't fit these very narrow criteria. And I'm almost worried. It's like they say, if you don't take out some normal appendixes, you're not doing enough appendectomies. That was the pre-CT era. But the fact that we're not denying people for insurance reasons may mean that they're looking at the website and they're being discouraged by what they see. And now, of course, with MA they've just increased the funding to MA, and it's certainly being pushed. It's pushed in commercials, it's pushed during open enrollment. So I think some people may have stumbled onto MA without even realizing what the barriers might be. So what I was thinking is that if there's one person in the room who probably could write this and do it perfectly, it's our Director Sy. So just saying. I wonder if, because it is confusing. And there are so many, Commissioner Chow has outlined all these various rubrics of the types of care, short-term SNF, long-term SNF, rehab, acute rehab. It would be really helpful if there were a table or something more explicit on the website, because I'm not sure I even understand it. And you would hate to see, you've made such great effort. The website's beautiful. And you've made such a great effort to show the community that Laguna is available. But then if you feel you look at these very narrow insurance criteria and you hit a hard stop and you don't even know how you can move from one to the next, we may not be getting applications that we'd otherwise want. So that would be, the only thought I would have about it. But it is something to think about in terms of the skill and knowledge we have in the room here.
Be happy to discuss with the team. Thank you.
Just to pile on here, the most vulnerable potential residents that was referenced in the testimony or in the comments by the public are those, again, that don't have a social worker or other kinds of resources to explain, the complexities. And even social workers don't always understand, depending on what county or, what the situation is. So I do think that whatever we can do to not just let people know that there are vacancies or that we're accepting residents, but here's how to do it. And here are some of the nuances that, as both Dr. Chow and Dr. Green have so well articulated, could really help the folks at Laguna Honda that are dealing with admissions also. So again, just reinforcing and supporting the comments that have already been made.
Thank you, Commissioner Gorham. I just want to add, our teams actually engage. Anytime somebody expresses an interest coming to Laguna Honda, we assist them through the process. We don't give them an application and then let them say, okay, you figure it out. We work with them. If they have questions, we connect them, what they can do, how they can connect with their physician and getting some of the information they need. Sometimes we bring them into our facility to do an assessment whether they qualify for Laguna Honda or not. So we do work with them throughout the whole process.
And I don't doubt that at all, but I think those who are discouraged from even attempting to contact Laguna Honda are those that might need, just the most, sort of basic encouragement. Yeah. Thank you. And not to take away from all of the progress that has been made, to be able to project that that we'll reach full census by December is, very optimistic and encouraging goal. So happy to hear that and look forward to seeing the reports that indicate that reflect that as we get them each month.
Thank you.
Are there any other comments on other parts of the executive team report? No? Okay. Thank you.
If I may, as the social worker up here, based on everything that was just said, when you all possibly tinker with the language, you might at the end just have a statement saying, we know this is very complicated. In case you've got questions, please call us. We're here to help you. I mean, just do a customer service thing so that it's accessible to everyone and people know like, wow, this doesn't make sense, but I could call the number or email the person or whatever. Just a suggestion.
Great
Thank you.
suggestion.
Thank you. Okay. Moving on to item 5, senior affordable housing at Laguna Honda Hospital campus, request for endorsement of a non-binding term sheet and authorization for Mercy Housing California to submit preliminary planning applications. I will pull up the presentation.
Good afternoon, commissioners. My name is Ann Romero, and I'm a senior project manager at the Mayor's Office of Housing and Community Development. I am joined here today by Sharon Kristen, a senior project manager at Mercy Housing California. In February, we were here to provide an overview of the proposed affordable housing development at the Laguna Honda Hospital campus. And today, we would like to review the draft term sheet to outline the main terms of the proposed development. So the draft term sheet is a non-binding document that outlines the main terms and conditions under which the housing would be developed. But I'd like to emphasize that this planning is at its initial stages and, elements of the project will change as the developments happen, but it would be in conjunction with the Health Commission. At next week's Health Commission meeting, we'd like to ask the full Health Commission to review and endorse the term sheet. To indicate approval of the proposed terms so that we may advance design and planning for the project, as well as an authorization for Mercy Housing to be able to submit a preliminary planning application to the Planning Department in spring 2025. The draft term sheet was attached to the presentation documents in the PDF document for your reference. Okay, next slide. And then I think we're on the next one, sorry. So the term sheet originally provides some history just so that we have a shared understanding, or at least that we are up to speed on the history of this proposed Laguna Honda Hospital housing development. And then, as you know, it is proposed that we would do 2 phases. And so the first phase would be independent senior housing with approximately 130 units and a 2-bedroom staff unit. And then we proposed that the Early Childhood Education Center would be part of this phase. Then the phase 2 development would either be a licensed assisted living, or what we are currently thinking may be more viable is to do an enhanced services rental housing development where the services approximate an assisted living level of care, because we believe that there are financing sources to make that happen. That is still being explored. And then the Adult Day Health Center for older adults would be part of that phase as well and would provide a portion of the services. Okay, next slide. As you know, this is proposed to be affordable housing for seniors age 62 and older. It is also possible that we could explore developing this project for seniors who are 55 years and older, if that really advances some of the goals of Laguna Honda Hospital being able to refer patients who could live in a community setting. There would be financing implications. So that is something we would need to further explore in a decision that would be made with you. The term sheet also addresses that one of the original goals of this project is that there would be a portion of units of each phase that would be dedicated to referrals from Laguna Honda Hospital. And the number of units depends on an assessment with close collaboration with Laguna Honda Hospital of what that need and demand might be. And then how could we arrange that with the financing. The proposed project financing uses standard affordable housing financing sources, which includes, first of all, a city loan. We have 50 million currently dedicated to this development from the Mayor's Office of Housing from that bond. And then also low-income housing tax credits, state funding, and then a senior operating subsidy. We are hoping to target to this development so that we could allocate a portion of units to be deeply affordable where residents would only pay 30% of their income in rent. And then phase two, similarly, we are looking at standard affordable housing sources, potentially the HUD Section 202 grant and capital program, and the SOS subsidy as well. We share with the commission the goal of providing as many deeply affordable units as possible. And all units would be at 60% area median income and below. Okay, next slide. So this slide lays out the schedule, and the initial items in bold are when we are expecting to return to the Health Commission and to the JCC with requests for approval, and also to provide updated information on how the proposed development is going. So obviously we had those meetings in February and March where we provided an overview. And then these meetings in April, we have this request for a non-binding endorsement of the term sheet, which is really a request for the Health Commission to indicate if they are supportive of this project moving forward, under the terms that are included. And also a request for DPH and the JCC and the Health Commission to authorize Mercy to submit a preliminary planning applications to the Health Commission. The reason why this is happening so early is really that the goal is to submit that planning application and for the project to be entitled by the end of 2025 so that they may be able to apply for financing in 2026. And so that is really on the critical path for this development. Then in September, we are intending to return to request for an endorsement of the proposed parcel map that we would create for the development and the approval of a memorandum of understanding for the two agencies and Mercy Housing that would really outline the roles and obligations and, provide accountability so that Laguna Honda would not be negatively impacted by the development. And it would also show the easements that we would need to develop. Then in January 2026, we would come back to request for approval of a jurisdictional transfer of the phase one site to MoCD. From my understanding, this is an item that is clearly for the Health Commission to decide if they would want to authorize this. The other option is that the parcel could remain under the jurisdiction of the Health Commission and the Department of Public Health, who would provide the ground lease. So that we would come back to discuss that item. Then if they are able to get the financing in 2026, we would return in early 2027 to request approval of a logistics plan, a license agreement, and easement agreements that would all need to be reviewed and approved by Department of Public Health, Laguna Honda Hospital, and the Health Commission. And early 2027 is the earliest start of construction that could happen if they are successful and applied for financing in 2026. Okay, next slide. This slide talks about the roles and responsibilities. And so for our agency, Mayor's Office of Housing, we are the lender for pre-development and the permanent phase. We would also do the bond issuance to fund the construction of the project. And we do monitoring and oversight of all phases of development, including during operations. Typically for affordable housing, MoCD acquires the land and acts as the ground lessor. And this is because then we have another area where we have oversight and leverage to make sure that the property is being operated according to the terms and restrictions. So that is typically MoCD has that role. It is possible that instead DPH could do that and we would still be involved. Then the Department of Public Health and Laguna Honda Hospital, we've already started working closely and the responsibilities are really around collaboration and planning around the program and the housing to ensure that that there would really be synergies created that would benefit both the residents at Laguna Honda Hospital and the additional housing, as well as coordination around the campus infrastructure and coordination around other hospital campus projects to make sure that there is not a negative impact. Then Mercy Housing California, as a nonprofit developer, would have all the development responsibilities. And so they would apply for the entitlements, and they would actually own the improvements, but under the ground lease. So the city would own the land, and Mercy Housing California's limited partnership would own the improvements. They would also have an arm that does property management, and they would be the lead services provider. And then if we are able to create this childcare and the adult day health center, they would provide the leases, and there would be other entities with that specific expertise that would operate those additional functions. Next slide. And so the term sheet also just outlines the financing terms from OCD as being the lender. And what we are proposing is our typical financing terms for 100% affordable housing. And that is that our loan has a 55-year term, and the loan is repayable with residual receipts. That is cash flow that is left over after operating. In truth, for 100% affordable housing, especially one like this that is deeply affordable, there is not very much cash flow. That all of that cash that comes in is used for operating the housing. So then also, I want to point out that Mercy, as the developer and owner and operator of the housing, they only collect allowable fees for asset and partnership management and a developer fee. And this is all regulated by MoCD underwriting guidelines and policies. We are anticipating that all of the units would be restricted at 60% of area median income or less. And as I mentioned, our goal is to have the units be as deeply affordable as possible. So we would be working to obtain operating and rental subsidies for many of the units. Next slide. So in the ground lease portion of the term sheet, it describes what is our typical ground lease. And that is a long-term ground lease. Really, it's public ownership of the land. It's a 75-year term with a 24-year option to extend. And this structure is really necessary for to finance the development with low-income housing tax credits. The standard base rent that is paid to the city for this ground lease is $15,000 a year, and this is paid from the building's operating budget. And of course, the reason it is so low is that this development is serving low-income seniors, and their rents will not support a higher ground lease payment. Residual rent would be surplus cash flow after repayment of all outstanding debt, and likely, given the affordability levels that we are trying to achieve, there wouldn't be additional rent paid. Then the uses for the childcare in the adult day health center would also be restricted to these public benefit purposes. And then, as I mentioned, the limited partnership controlled by the Mercy Housing California will own the improvements in fee, but the city would own the land, be it under MoCD or under the Department of Public Health. And so it also discusses the potential jurisdictional transfer of the parcel to MoCD from DPH if DPH and the Health Commission would like MoCD to be the ground lessor to take on that responsibility. And we believe that this would allow for MoCD to more efficiently be the long-term performance monitor of Mercy's performance. However, if it goes the other way, we would definitely participate and still monitor as well. It would just be a little bit more complicated. Next slide. Okay, and then this is just a review of the appendices that were attached. So the first is the draft term sheet. And then the other appendices were just for background information, but were also provided in the previous presentation an overview of the key legal documents, the preliminary site plan, the preliminary unit count and program, and the preliminary project schedule. Of course, as we get more into development, there'll be updates to all of these items, but we provided these appendices so that you could refer to this as additional background. So I'm very happy to answer any questions, as well as Sharon Kristen here from Mercy Housing California. And we ask for your support in moving this item to the full Health Commission to request the endorsement of the draft non-binding term sheet and authorization for Mercy to submit a preliminary application to the Planning Department for entitlements. Thank you.
Thank you for your presentation. Is there public comment?
Yes, there's public comment in the room. Please come up, Mr. Degelman. This is your opportunity to speak about item 5.
My name is Norman Degelman. I'm a member of the Gray Panthers, excuse me, and I'm quoting Dr. Palmer. 100% of the units will be restricted at 60% of MOHCD, AMI, or less. Mercy and MOHCD will maximize the number of units with operating or rental subsidy to allow residents to pay 30% of their income for rent. This will allow the unit to serve extremely low income household, base rent of $15,000 a year. Comment: what does maximize mean? No endorsement should occur unless all units are deeply affordable, i.e., allow residents to pay just 30%. This public land must serve the people of San Francisco who are in need. A land grab to generate revenue has no place here. No endorsement should occur until this language is changed. Thank you.
Thank you. We have anyone else in the room? No. We've got a few hands up. Dr. Palmer, you've got 3 minutes.
Hi, can you, thanks. Can you hear me?
Yes.
Yeah, I don't understand why all the units are not deeply affordable. This is basically free land for Mercy Housing, and there is no 60% of AMI is nowhere near what an impoverished senior can afford. The average Social Security check is less than $1,000 a month. And so 30% of the income is what is deeply affordable of whatever income you have. And this should be the criteria for all of these units. And I urge the Health Commission to stick to their guns, keep this, only endorse this if it's deeply affordable. Otherwise, it's a land grab that's going to be generating revenue for the nonprofits, but not serving the people of San Francisco. Thank you very much.
All right, thank you. And we've got one more. Mr. Minette Shaw,
Yes,
you've got 3 minutes.
thank you, sir.
I urge the LHH JCC to reject making a recommendation to the full Health Commission to endorse a non-binding term sheet for the Mercy Housing senior housing on LHH's campus for many reasons outlined in my article and below. Surely, this commission knows that voters were never told in marketing materials for the 2019 affordable housing bond that the senior housing at LHH or elsewhere would include child care facilities, let alone an early child care education center. But voters were told the bond would only be used for senior housing. My West Side Observer article that Mr. Morwitz forwarded you this morning shows there are many reasons LHH's campus is an inappropriate site for senior housing, given its isolation up a 105-foot change in elevation, up steep hills the elderly can't walk up, no surrounding neighborhood serving retail, and limited public transportation between the Forest Hill Muni Station and the top of LHH's campus. No shuttle bus service after 5:50 p.m. on weekdays and no shuttle bus service at all on weekends. The two-phase project won't open until 2029 at the earliest, and the assisted living may not receive funding or be built at all. In addition, Elon Musk and his sidekick President Trump have taken an axe to HUD funding and have threatened to withhold funding from all cities having sanctuary city policies. It's unlikely the LHH housing project will secure HUD Section 202 funding or HUD Section 8 vouchers. The project should be moved to another location in our city. In addition, voters were not told that an yet unknown percentage, or any percentage, of the senior housing units at LHH would be reserved for LHH residents following their discharge from the hospital as a housing preference set aside. And to now learn Mercy Housing is exploring opening eligibility to the senior housing to those as young as 55 years of age is yet another egregious bait and switch. As well, voters were not told that LHH residents who can live in a community setting with on-site supportive services will receive preferential placement at LHH. Indeed, voters and San Franciscans have been told all along that Phase 1 is supposed to consist of only independent living apartments, not apartments for people needing supportive services. Plans for senior housing on San Francisco's Laguna Honda Hospital campus have changed again. The promised 375 units for independent senior apartments and assisted living units has been cut back to a now more probable 124 units, a staggering 67% change loss of planned housing units. It's not the only bait and switch. And the LHH campus is still completely inappropriate for senior housing. I urge the LHH JCC to reject making a recommendation to the full Health Commission to endorse a non-binding term sheet for the Mercy Housing senior housing on LHH's campus. Thank you.
All right, thank you. And that's the last public comment on this item.
Okay, thank you. Are there questions or comments from members of the committee? Dr. Chow.
Yes, thank you for the presentation, and I'm sorry that some of us got a little late. So the details are sort of difficult to understand at first reading, but I'm trying to understand what is a we just start with that. What is a non-binding term sheet? I mean, you have made statements in here about the different levels of participation by finances, by age, and also trying to understand the project financing. So obviously, this is a very complex situation. But what do we endorse if we actually are going to approve a non-binding term sheet?
Oh, yes, thank you. It's a very good question. From my perspective, the term sheet is when we are at a very preliminary phase, just starting out this development. And it outlines how we think we can put together this development, what the potential unit count is. It could go up. I don't think it'll go down. What are the intended affordability levels, how we will provide the funding. So it's an outline at this preliminary stage of how we envision that it's possible to structure this development. The reason that it is non-binding is because we don't yet have any approvals or loans in place yet for you to approve. So I think the point of the non-binding term sheet is to outline how we think we can develop this project so that we can have the same understanding of what the goals of the project are before we have any final approvals, because the design still needs to be developed. You know, all of the details need to be developed that may impact some of these components. And it is not until we get to them submitting applications for state financing where really there would be some requirements put in place, and the city's loan agreement would have definitely requirements, but we're at the just beginning stages. So this is an intent to explain how we think we might be able to develop this so that everybody can be on the same page and see if the Health Commission is in agreement with these goals and objectives.
So as we're going along developing it and looking at your timeline, it looks like it's between April and September. You're going to try to answer these questions more specifically. Is it going to be 62 age? Is it going to be a 55-year age? Will Laguna have priority or options? And also in terms of your financing and you would then also be coming up, I guess, during that period of time with some sort of preference of lease versus transfer right to the mayor's office. as being options. So at what points would it be reasonable if we were to say, yeah, this is sort of a preliminary game plan? But as you fill these questions out, where would we then, I mean, to get this 6 months later, and it's kind of a fait accompli, right? And here comes the final product. Could you suggest a way in which at different periods of time, say whether we answer the age or we answer the money issue, or we have a change in number of beds, or we run into or we understand from Laguna they would like 15, but financing says you can only do 5 or something. So at each of these decision points, because then it would make us feel more comfortable as to fleshing out what is a very nebulous. I mean, it's a outline that shows us the complexity and the many decisions that have to be made. But I think somewhere for us to then at the end finally say this is really a good project, some input would be helpful probably from your side, so that we could then some answers, so that we could then give you additional input and work together to try to see if we can have a project that then meets everybody's needs.
Right, most definitely. And first of all, we are meeting bi-weekly with staff from Laguna Honda Hospital. And our intent to develop this senior housing there is for it to be compatible, create synergies, not create problems for Laguna Honda Hospital. So we are already working closely with staff from Laguna Honda Hospital and from DPH. Furthermore, we're very happy to come back as often as you would like and give an update of how the development plans are going. Since we are at this initial stage, fleshing out the design and the parcel map will then help determine how many units can go on there, what easements, how the infrastructure can be placed. Like those are really early design questions that will be worked on and that we can then bring back to you. The standard for age for affordable housing for seniors is 62 years of age, and that has always been anticipated. The only reason we would consider 55 a younger age is if that would broaden how many referrals that the Laguna Honda Hospital could send if that was desired by Laguna Honda Hospital. So we are trying to be flexible, but the typical senior age is 62. So I guess I would say that by working together closely with the staff in the development to create something that is beneficial to Laguna Honda Hospital and will create this additional affordable senior housing, and by returning to the commission whenever you would like to provide updates, that is how we would like to proceed. But this is really just the starting point.
So because you and your group have to do all the work, what would be reasonable timelines to answer some of those questions that could be brought back to the commission? If the commission were to say, let's move forward with a term sheet with you, as you've outlined. In other words, you're probably best to help us understand, well, we can probably work out this part of it. Say the bed days, is that going to take 3 months to work out or a month? And then maybe you've answered the question working with Laguna about they would like age 55 or no, maybe we can't. So those 3 or 4 items as we've been discussing here, kind of more concretely come to us at each of these stages so that we could be collaborative about this and also feel that this is really going to work for the benefit of all the citizens.
Right. And I would say if we go back to that schedule of when we were planning that we would come back, in the fall is when we would have a preliminary parcel map that would define what the parcel would be. And also Mercy Housing would have really advanced their design so we could provide, that design. So we would have much more certainty about the proposed unit count. And then also regarding the age, one of the next steps is to create a work group of experts within the city and then also in the senior housing field and in the healthcare field to look at this enhanced services model and like what is possible. And so Laguna Honda Hospital staff will be participating in that. DPH, DOS, the department, the Disability and Aging Services, as well as senior housing providers who are experts in the long-term care field to look at what is possible and what are the parameters. And then we need to look at how can we finance that? Is that possible to finance? So a lot of these, this information, I think, will come together by the proposed time of coming back in the fall. When we have our preliminary parcel map, Mercy Housing California will have advanced the design. We'll have more of an idea on the unit count, and we'll have looked at financing scenarios.
Okay, well, at least for myself, the fall sounds like a lot of it is sort of already in play, and we're not getting, or you're not getting the feedback from us also as part of the input for making those decisions. So I would just wonder whether it be at this committee or the full commission, that we should try to get updates in a more reasonable time frame, be it a month, 6 weeks, or something. Especially, we're only talking about what, one quarter, basically, I guess, April, May, June, July, August. Yeah, about 4 months. So I don't think it's unreasonable as you're, and I think I heard your offer about coming as often as we'd like. I think we need to work it out whether the commission feels more comfortable having it before the full commission or at Laguna JCC, that there should be, my preference would be a monthly report during this period of time, because that's really key. And for us to feel then that also Laguna staff is, pleased with this, and then commissioners could make their comments about what they felt, and that could be taken into consideration as you move forward towards this September date.
I would also suggest that that we be very specific about the kinds of questions that we would like an update on. And given that there is a weekly meeting with the Laguna Honda staff, that if during those meetings, if anything does come up that the staff believes is going to be of concern to either the JCC or the full commission, that is a specific issue that will be raised, and we don't go any further until that issue, if there is such a one, separate from an update, can come to either, again, the JCC or the full commission for some clarification or some resolution. And so I think that so it would also be not just on MoCD and Mercy Housing to answer all of the questions, but also on our staff to make sure that they're representing the concerns that that the commission, the JCC, on behalf of the commission has, because the negotiation around what happens based on this outline of the term sheet is something that sort of transacts on a regular basis, not something that's easily able to be brought to a monthly meeting in order to resolve and move forward. So I'm just, my familiarity with these things is there's got to be some onus on the part of the staff to represent what the concerns are, and then to flag that so that it then can be scheduled for a meeting separate and aside from whatever update, which could be a very it could be a very brief update as to sort of where we are in the process versus something that needs some resolution or some dialogue and discussion. So let me go to Commissioner Green first before we make we have more dialogue on what the next step is.
Yes, well, I absolutely endorse everything my fellow commissioners have said. And most of the information, I do want to read Mr. Manette Shaw's article as well, came this morning, and I didn't have time to look at any of it. But I think, we've obviously outlined what our concerns are. I mean, there's simple things we don't know, like if people have to pay their own electric bill, that's going to be a deal breaker for many low-income individuals. So even something as simple as that, I don't see as part of this proposal. So I think you well understand, what our concerns are. We obviously are so grateful to all the individuals that see the potential here, but we also know that finances can be an issue. Identifying the individuals who qualify for the housing can be a question, how the childcare fits into it. I mean, there are a lot of obviously things you can't know, but insofar as we can clarify some of the items as time goes on, I think we'd really appreciate that. And I think a monthly update would be helpful, along with any behind the scenes changes that we would want to know about can be communicated with Commissioner Guillermo, who's both vice president as well as chair of this committee. So I think we all agree that we definitely want to be on top of it. We have an obligation to be, but also to support what Supervisor Melgar and so many others feel is such a worthy project.
Oh, okay, Commissioner Chow.
I think that all this goes to say, and I do want to thank where this document on responses came from, because staff was quite thorough about it, and that was very helpful. I did have a chance to go through it and realize how complicated this whole thing is. But I'm wondering if we should try. First, the other commissioners have not read the responses on some of this. We could still work out, I think, need to work out when we're going to get the monthly updates here, or there's some milestones that we should really be hearing about, be it, if you've really come to a conclusion about one of these segments that we talked about, and there's probably only about 3 or 4 big issues. It's not even as much as the design. Obviously, we need a design, but the design has to then fit what we're going to put into it. And it's that which I'm looking at. And if we could work something out before the commission meeting, I think that the commissioners, this is really important on the part of the Health Commission function, that we as the joint conference have helped to massage further to be able to bring to the commission a proposal, which if with the commission's agreement would then include regular updates and some sort of schedule about what might be topics that will be covered. And like to hear, wonderful that Laguna is going to speak for us.
Yes.
To us rather. Up there.
I'm speaking from the network, and we'll let Diltar speak from the network.
Sure.
But as Ann did say, both Laguna and DPH meet with MOH, CD, and Mercy every 2 weeks. I'm a part of that meeting, so is Diltar, and so is Mark Primo, who's going to come up in a moment. As you know, Mark Primo has been the long-term capital projects advisor on all of our major initiatives, including the building of Laguna, the building of a new San Francisco General, and he is closely advising this process, and I think can help give us a path forward towards the way you just mentioned, what would be appropriate to come every month to make sure that you're getting the information you need to appropriately support the project at its various stages before that September big milestone. So I'll ask Mark to really come and help us frame how we can move forward to get you the information that you need.
And as Mr. Primo's coming up, please come up. I'm just wondering if you all feel like it might be helpful for me to be in the meetings to represent just hearing, not participating, but hearing. I can represent what you all are wanting, and I can be like, okay, wow, that's an issue, and I can tag it, because honestly, I'm the only person in the department who is working for you, and it's not fair to expect everyone else to kind of keep in mind what you all need, and it's my job. So I'm very happy to do that if it would make sense, and if you all would let me. I'm happy to be a go-between and then try to represent that differently and better so that I can make sure that the issues are brought to you. Just a thought.
Commissioner Mark Primo, I think that's a great idea, Mark. It's almost similar to Jen Lowe sitting in on some of the meetings so we can tighten up the communication and speed it up. Actually, just in my folder, I had a resolution that this commission passed on the UCSF research building almost 10 years to May in 2015. And if you guys recall, we had more frequent meetings in the beginning as we figured out like the terms of the ground lease, the design, the setbacks, the circulation, the easements, the parcel map, almost very similar to this, but not as complicated. And then we went to quarterly presentations, and the non-binding term sheet is just the umbrella, the conceptual, because in the UCSF example, what we thought we were going to do in some cases, like with the former Commissioner Sanchez roadway between the existing main hospital and the research building, we hadn't worked any of that out. In fact, we were still negotiating with UCSF. So I think Commissioner Chow, you're right on the mark. I think we should be here more frequently. Then I think having Mark be sort of the eyes and ears to kind of guide us will get the answers that I think you're seeking.
Okay.
Yeah, and I thank you, Mark, for that, for offering to do that. You always do an excellent job of translating for the commission and its interests within both the department and external to the department. I think that some of the complicating factors here are because there are concerns about the project that are not necessarily the jurisdiction of Laguna Honda, for instance, in terms of affordability and that kind of things. But we are, because we want to represent the issues of the citizenry of San Francisco, even though it may not directly be part of Laguna Honda's and the commission's jurisdiction, we want to be able to represent those as well. And so that's sort of part of the sort of the complicated representational piece that we're bringing to the table as well. But I do think that Commissioner Chow's recommendation of having a monthly update and then also making sure that the specific issues that we have jurisdiction over, or if not jurisdiction of particular concern, are brought as a focus, again, facilitated by Mark attending the meetings and the Laguna Honda staff and the network also understanding that we can assure the full commission that the JCC is doing its job in representing, and we don't have to wait for the full commission for each step of the way. And I would suggest then that the updates would come to the JCC and we would schedule them for the full commission as needed.
So I think if we are able to consolidate all of this for the commission meeting, I don't think we need to make a recommendation to the commission. This isn't going on a consent calendar. This actually would be heard before the full commission. Many of the questions you've answered very nicely, and the commissioners should be able to then absorb that. We'll try to put it out in a more timely fashion. It's not your fault. I mean, everybody is stressed. So, and to even get such a comprehensive answer, I think we should compliment the staff over at the mayor's office. It's really, and others who participated in this so that document also is very good for forwarding. And that if we then had a proposal that was available saying we're going to have monthly updates at the JCC, and that the commission would be able to, and JCC can report or in fact say, gee, this is really important, let's have that at the commission level. Then the monitoring of that would be down at the JCC. We could then trigger within this 4-month period. If it's an update that we can give and we feel comfortable that that's within the parameters of what the commission wanted, then we can do that and they can ask us questions at the JCC report. If it's a decision to be made, we then here would recommend that we bring that topic to the commission and agenda it for action rather than just a report. And I think that maintains a flexibility so that it would work together with how the working committees are working, and yet we're kept up to date. I think Mark's very generous in offering his time to sit on that committee, and that will probably assist, I think, the committee in understanding we're here to be collaborative. We feel that the project is very important for the city, and at the same time, we want to be sure that we have done our due diligence to be sure also that our charge over Laguna has been discharged in terms of it being something that also is beneficial to Laguna. So that would be sort of my proposal, that we would bring to the commission sort of an outline of what we said. And then the commission could take up whether then we want to move forward, because you don't have the term sheet, we can't move forward. And we can't have any of these reports. But I think rather than us making just a consent item, which is usually what we do when we've made a recommendation.
It wouldn't have been a consent item,
It
just so
would
you
not
know.
be.
It was just, and I apologize for interjecting, just because we're trying, I think the intent was the committee usually does its due diligence
Yes.
and the full commission hears. And I think there was concern, like with the bylaws, that sometimes other commissioners dive in deep and without a recommendation from folks who've already reviewed it to say, this sounds like a good idea to us. So that, I think that was the intent today of you all approving it. Of course, there was a snafu with you not getting material, so that makes sense that you might want to defer. But I would encourage you that even if you don't vote today, that in the introduction of this, that you will maybe spin a positive thing, that sounds like you've figured out a collaborative way to work with us, and that you feel like this is a good idea to move forward, so that the commissioners won't maybe dig in and spend a lot of time over everything. That's my two
Yeah,
cents.
I think what I can do in my report is to, with your assistance, Mark, provide an extended report on this, from this committee on this particular issue, addressing a lot of the things that we know that the full commission is, and then with the presidents sitting on this committee and representing the full commission's interests, I think that we can sort of get to that point. But I would not necessarily ask for us to postpone a recommendation to the full commission at this point. If we have a better handle right now on what we would like to do to move forward.
Yeah, I agree that if the commission believes that this is a project that we need to move forward to, and we feel also that the outline is reasonable to work on, that can go as long as it's not a consent calendar item, and that therefore the commission will then make the final determination. So I don't see that as a problem. I was just concerned that it would then be a consent item under our usual consent.
I apologize for not making that clearer. It would be the same kind of item that we have today, would be a presentation, so that
Yeah.
everyone could see it. And
Be a
then
full agenda item.
Yeah, I think you need it as a full agenda item, and then our chair here can present what this committee has been discussing and how then we worked out this potential way of implementing for us a due diligence over the term sheet.
Sure, great.
And of course, requesting that members of the committee jump in if I miss anything in the presentation. Okay,
So how would you like to proceed this moment?
yeah, so I would like to then, oh, did you have another comment?
No, I just wanted to make sure we have clarity for the team back here, so that if this goes forward as you're speaking, so that when this comes to the full commission, in addition to the presentation, you'd like that, what that monthly cadence and process will be to be included in that report to the full commission.
Yes, absolutely. Yes, yeah.
And then if in fact, in working with Mark, you identify these 3 or 4 key items that we continue to discuss about, all the way from age down to eligibility and all, that would be helpful to, I think, help synthesize for the commission. I know that you could do it in your report, but it would be nice that if it also came saying that in our monthly reports, this is what we're going to be reporting on, our progress on these major items. So the commissioners would feel comfortable that we have listed, and maybe somebody's got another item they would like to be tracking.
And that's the benefit of putting it as a full agenda item on the full commission.
Yes.
So we'll do that, and we'll look forward to having Mark join the every 2 weeks meeting.
So at this point, then I'll ask for a motion to recommend to the full commission with that sort of expanded notion of requirement of the monthly updates.
And I'll
then-
recommend that.
Yeah, okay. So moved. Is there a second? Okay,
Oh, great. All those in favor?
aye.
All right. Thank you. Thank you all.
Thank you for your presentation and for your willingness to, as you said, come to as many meetings as necessary. And your appreciation for the concerns that we have in representing both our population at Laguna Honda as well as the population of San Francisco, and those who are the most concerned about the vulnerable population that we're all trying to accommodate with this housing project.
And someone please just shoot me an invite to the meeting so I know to calendar. Okay, great. Thank you. So we can move on to item 6, the hiring and vacancy report. Thank you all for your patience. Is Priya on the line?
Yes, I am.
Oh,
And
hi.
I want to make sure that I take any questions from the commissioners today. Thank you.
Oh, let's see if there's any public comment. I see a hand, so I'm going to unmute. Dr. Palmer, do you have a comment to make on the hiring and vacancy report?
Oh, no, I'm sorry. I
That's
just,
okay. Oh, it's fine. It's fine. All right. So no public comment. Any questions from you?
Any questions or comments?
Well, I think they have answered in writing our concerns that the changes in hiring and the freezes would not be affecting our accreditation or licensure. So that was the only question I asked. I
Yeah.
think Commissioner Green asked the same one.
Yeah. Any additional? So then my only comment would be if the freeze does begin to impact patient safety and care, that be noted and in detail, I think. And as well as any of the survey issues that might come up as a result of the freeze. Do we have any sense of when things will be unfrozen? Thank you, Anne.
Good evening, Commissioners. Luana Kim, Chief Human Resources Officer. Thank you for that question. Currently, we know that the hiring freeze will go until June 30th. So we continue to prepare in many ways, but we are very mindful of the need as a public health department to continue to make sure that our critical vacancies are filled. So we have a lot of resources deployed to that and are monitoring it closely. So if anything changes, we're happy to let you know.
Okay, thank you.
Thank you.
And thank you to Ms. Kim and her staff for advocating for us, because they go to the mayor's office and try to, position by position, try to get our stuff unfrozen. So thank you. Any other questions or comments on this item? Okay, great. Thank you, Priya. We can move on to item 7, the regulatory affairs report.
Good evening, Commissioners. Geraldine Mariano, Director of Regulatory Affairs. I will present the March 2025 Regulatory Affairs Report. During the March 2025, Laguna Honda had 12 cases of facility-reported incidents that were reported to CDPH and 1 anonymous complaint shared by CDPH. CDPH has not started their investigation for the 12 cases for the facility-reported incident. CDPH also came once in the month of March to investigate 1 anonymous complaint. This was closed with no deficiency against the facility. At the time of this report, there were 45 cases remain pending for investigation of CDPH. CDPH just completed a 3-day abbreviated visit with Laguna Honda last week and reviewed 15 cases with no deficiency against the facility. Thank you.
Let's see. I see a hand up. I'll try again. Dr. Palmer, do you have a comment on this item?
No, yes, can you hear me?
Yes, we can hear you.
Yeah, the main concern I have is that CDPH is falling behind again. I mean, is there anything to be done about that? I mean, you don't want these things to pile up. Thank you.
Commissioners, any questions or comments from you?
Are there any? Okay, thank you, Geraldine.
Yes.
We'll move on.
We can move on to item 8, the hospital policies. Oh, Carmen, we're not able to hear you. No, there's nothing. No, I'm sorry, unfortunately.
Yeah, can you hear me? Oh, I think I heard you, Carmen. You can hear me now?
Yes, yes.
Okay, great. Sorry about that. I got a new headset. Good evening, commissioners. My name is Carmen Trin, Director of Performance Improvement, and I will be presenting the hospital policies and procedures. Today, the facility is presenting 14 policies for review and consideration for approval, 13 facility policies recommended for revision, one facility policy recommended for deletion, and 5 departmental policies recommended for revision. Thank you.
Thank you. Is there any public comment?
I see no hands.
Okay. Again, thank you for your responses to questions. Is there any additional questions or comments, Dr. Green? No? Okay, we need to have a vote.
Yes.
To recommend
To the full
approval
commission.
to the full commission.
I recommend that the policies and procedures as presented be recommended to the full commission for approval.
And I'll second that.
And all those in favor?
Aye.
Okay, thank you. We can move on to consideration for a closed session.
Let me just,
Oh, I apologize.
I know that we already voted, but I wanted to make sure that Commissioner Chow had a chance to comment or question on any of the policies and procedures that weren't already.
No, I thank staff again for the responses that we received in such a short period of time. They answer my questions.
Okay, thank you. We can move on.
Great. Now a consideration of closed session.
Move to closed session.
Second?
Let me make sure there's no public comment. I see no hands.
Okay.
So all those in favor?
Aye.
All right, great. If you could give me 30 seconds, I need to close the doors and get us into a closed session. Thank you, everyone who is watching from the public. You will not see or hear us while we're in closed session, but we will be back. And thanks for your public comments too. Okay, we are back in open session. Commissioners, you approved their credentials report and the PIPS minutes report in closed session. Please consider a motion to vote on whether you would like to disclose other discussions held in closed session.
Move not to disclose.
I would second.
All those in favor?
Aye.
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 Thank you. And then now you're at a consideration of adjournment.
Move to adjourn.
Second?
All those in favor?
Aye.
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 All right.
Okay.
Thank you so much. Please give me about 10 seconds to stop us, to shut us down. Thank you, everyone, for watching and those who presented.